You have cancer. More than 8 million Americans alive today have heard those words. The words have launched them on a journey that usually begins with 2 more words: chemotherapy, radiation. There are side effects to taking the cure for cancer, side effects that can make the cure a curse. One of the most common, fatigue. The patient's body uses all its reserves to battle the disease and remake normal cells killed by the treatment. Patients often feel depleted, weary.
Everything tires you out. Everything is exhausting. And it's very discouraging emotionally too, because it's depressing to not be able to do the things that you did before.
Doctors, faced with their patients' exhaustion, often prescribe what may seem impossible: exercise.
Fatigue does lead to more fatigue. Patients begin to lose muscle mass. They become less vibrant at a time when they need all of their energy. There is also an emotional toll to cancer and its treatment. It's much easier for patients to become depressed. They begin to lose energy for a variety of reasons, and exercise can break that cycle.
But exercise for a cancer patient can be daunting. It's often the last thing a patient feels like doing.
When I went through the chemotherapy, that process of thinking of exercising was not something I could handle.
A second common response to cancer is stress. Patients often are facing the biggest crisis of their lives, and stress is normal. But stress can profoundly affect a patient's health by increasing blood pressure, decreasing blood flow to tissues, and compromising the efficiency of the immune system.
The stress that comes from first finding out that a person does have this disease is more than a guy of my age have had since the day I was born.
Again, doctors frequently prescribe strong medicine for stress: exercise.
I do strongly recommend and encourage my patients to adopt some form of an exercise program. Exercise does not have to be physically rigorous. It does not have to be what we normally think of as heavy aerobic exercise. There are alternatives.
Forward, hand comes across, back up to stop position, pull in, push, relax.
The alternative is a unique medical exercise program offered by the Cancer Institute at Alexian Brothers. It's designed to complement cancer therapy by helping to offset the fatigue and stress that usually accompanies it.
Breathe in. Gonna breathe in the sunlight. Good, then breathe out.
The program, called Medical Tai Chi, is a combination of ancient Chinese martial arts and Western medical concepts. Tai Chi-like movements are best known here in the U.S. as a gentle form of exercise, with surprising benefits for cancer patients.
There has been research cited by the American Cancer Society that speaks well of Tai Chi. Tai Chi has been proven to have the same fatigue-fighting elements that moderate exercise has, and Tai Chi has been proven to reduce stress. Tai Chi is an excellent complement to conventional cancer therapy.
The American Cancer Society has recommended Tai Chi for those individuals who are older, for those individuals who have more sedentary lifestyles, and for those individuals who may be more physically unfit.
Now we're going to circle with the right hand, step forward, left hand extends.
The creator and director of Medical Tai Chi is Dr. Patrick Massey, president of the AltMed Medical and Physical Therapy Program. Dr. Massey may be the only physician in the country with a medical degree, a PhD in immunology, and a 6th degree black belt.
The core of Tai Chi is really health. And unfortunately, in order to achieve health benefits in traditional Tai Chi, it can take a large time commitment. What I have done is I have cleared away those time commitments and a lot of the formality that has been associated with Tai Chi. Put all the health benefits into a program that's really just fun and very relaxing to do.
All right.
We laugh a lot.
There we go.
We joke around. The term Tai Chi by itself sounds very foreign. So what we've done is we've added the word medical to it. Put it inside of a medical setting with physicians and therapists, and that's something that's much more comfortable for many patients. We've combined Western medical knowledge with Eastern movement therapies into a program which is really unique.
I signed up for a Tai Chi course with the master, and it was traditional Tai Chi. It was hard to do, it was very tiring, and doing Dr. Massey's was much, much better.
Dr. Massey and his staff offer basic, intermediate, and advanced editions of the program, each taught in a series of 6 weekly 1-hour classes. It gives patients all they need to bring this stress-reducing workout into their daily lives.
This program was designed specifically for cancer patients undergoing chemotherapy, radiation therapy, and all the physical stresses that go along with that. So we designed this program to be very low impact, but it has high medical benefit.
The combination of 3 elements give the exercises their powerful effect: movement, breathing, and meditation.
We're going to start with some of the basic movements in the program.
Dr. Massey's program begins with a series of slow, simple moves. Then, over the weeks, he demonstrates more involved exercises, gradually building on moves taught earlier.
Physical fitness in the United States is often associated with working very hard, sweating a lot, and that's not necessarily the case. You can get significant cardiac benefits, you can get significant benefits on blood pressure, you can get significant benefits for arthritis and for stress reduction by doing moderate to mild exercise. And Tai Chi is moderate to mild exercise. There's nothing magical about it. It's a very ancient form of exercise that people have been doing for thousands and thousands of years.
At the end of the 6 basic sessions, patients are welcome to try the intermediate and advanced courses.
I want you to be breathing in through the nose, and you're going to be breathing out through the mouth.
A key to the health benefits of the medical Tai Chi program at the Cancer Institute is its focus on breathing. Actually, the connection between breathing and exercise.
The American Cancer Society says that there is research to support that these simple, slow, easy movements can reduce blood pressure. One reason is that these gentle exercises of Tai Chi are coupled to a very special form of deep breathing.
Most breathing happens with very weak muscles between the ribs called the intercostal muscles. And so as we get older and those ribs don't move as well, and so our breath becomes shallower and shallower. If you start breathing with the diaphragm and using the powerful abdominal muscles, you can pull in a great deal more air into the lungs and clear out a great deal more toxins. Cancer patients are really building up a lot of toxins. It is much easier for the student to experience it first and then be able to go into the science after they have experienced it a few times.
But I want you to imagine that you're going to be transplanting your nose from your face to 2 inches below your belly button.
As the sessions progress, Dr. Massey and his staff work on teaching their patients how to breathe in rhythm with the movements.
It's a much more effective and relaxing way to breathe. When you can bring more oxygen into your body, it helps every cell in the body work even better.
You're using stronger muscles to do the breathing, so patients don't become as fatigued as they do with normal breathing, even with the fact that they're bringing in more oxygen and clearing out more toxins.
I want you to lie down now.
In addition to the movement and the breathing, there's a third vital element in the effectiveness of the medical Tai Chi program: meditation.
Okay, I want you all now to start to go to that special place.
After 45 minutes of concentration on breathing and movement, patients are naturally close to a meditative state. During the last 15 minutes of every session, Dr. Massey and his staff use guided imagery to lead them the rest of the way into meditation.
Could be by the ocean, could be by the mountains.
In reviewing the medical literature, there is evidence that meditation reduces stress levels.
Just sitting down and starting to meditate and being able to quieten your mind and clear your mind is very difficult to do. And so people probably become very frustrated with that. Interestingly, doing some very simple movements, especially with breathing, coordinated with that, helps to calm the mind and puts a person in a meditative state quite often before they even realize it.
I honestly thought it was pretty silly. I couldn't even imagine myself doing something like that. It just didn't seem like a guy thing. Now I find it internally calming. Everything just slows down that much that you just have time to see what things really are. The baseball is like a basketball. You're in a groove, you see things clearer.
After 15 minutes, the patients get up and the session is over.
The physical movements, the meditation, the breathing forms, all have profound medical benefits on the stress and fatigue that cancer patients have secondary to their chemotherapy and radiation.
By taking control of the stress, which I've learned to do basically with Tai Chi, it has made my health completely different. It's made my attitude in life completely different.
Since I started Tai Chi, the blood pressure medication has been cut in half. And the doctor feels that within the next month I will be off blood pressure medication completely.
Since I've been taking Tai Chi, I have much less stress. I feel better, and I have to say I'm a better person for it.
Battling cancer may be the toughest thing you'll ever do. You may need to find new ways to tap the strength inside you. With the Cancer Institute at Alexian Brothers, you don't have to make that search alone.